Hi students, today we are going to discuss about the renal function test and renal clearance and diuretics. So in the renal function test, I hope it will be easy to understand when you separate the topic. So renal function test. So this test going to be checking for the whether properly the function of the renal system is working or not. Properly it will be function or not. Okay, that is a renal function test. Then what are the renal clearance? So we have some types of the substances that we're going to see the further slides. So that's how can we make the clearance, and what is the diuretics? So we are going to be discuss about these three topics. So first of all, we are going to see the what is the renal function test is composition. So what are the uses? So test to assess the glomerular function and test to assess the tubular functions. Actually, in the renal function test, we are going to be check first the urine and the blood. So why we are going to be checking the urine and the blood? So if we have to check this urine, so that is a reasonable. So why we are going to be checking the blood also? So now we have to come to the point. So for the checking the blood, actually you have to know about this how much substances, for example urea, creatine, so how much substances which is how to be present in the blood, so how much it be filtered. So we are going to be have a clear idea about how to test about the in the blood. Okay, so that is a to test to assess the glomerular function. So these are things that comes under the clearance test: blood, urea, serum and creatinine. So in other hand, there is a test to assess the tubular functions. So I told about this one. So here there is a urine concentration and dilution test, urine acidification test, and it's a test for the tubular secretory capacity. So these are the test is fully by the urine, and it's for the glomerular function we are going to be assessed by the blood. So now I hope you understand. So why we are going to be taking the both the blood and as a urine. Okay, the blood for is a mainly for the to checking the glomerular function, and urine we are going to be checking for the tubular functions. So now we have to know about this, what is the basic examination. One is the urine analysis. So what are the things which is present in the urine? Another one is the blood analysis. So what are the substances which is present in the blood? So by this way we are going to make the examinations. And so what are the techniques? So now there is a recent techniques like as a radiology, renal imaging and renal biopsy. So these are the recent techniques we are going to be just make the renal function test and test to the assess the renal blood flow. So these are all the techniques, which means all the test is belonging towards the renal function test. So once you finish all the tests, you will take the you will get the complete renal function test. Next we are going to see the what are the tests is coming under the to checking the glomerular function test, and what are the tests is coming under the tubular function test. So now first of all we have to know what are the tests is coming under the glomerular function test. So then only have to be confirmed there is a glomerular will be properly be function, isn't it? So now first the blood urea determination, blood creatinine estimation, urine clearance test, creatinine clearance test, and urea clearance test, and is a para amino hepatic clearance test, estimation of the protein in the urine. So these are the tests that comes under the to checking the glomerular function. So this will be the glomerular function test. So next we are going to see about the tubular functions. So here there is a urine concentration test, urine dilution test, detection of uric acid excretion, test for the acidification of the urine, and test for the alkalinization of the urine, and test for the amino acid in the urine. So these are the tests comes under the to assess the tubular functions. Next we are going to see the to assess the renal plasma flow, and is a basic examination which I already told about this urine analysis and blood analysis. So what I already told in the previous slide is recent techniques will be just by the radiology, renal imaging and renal biopsy. We are going to be just assess, or we are going to check the renal function test. And Next, as a basic examination is a urine analysis and blood analysis. So we have to know about this and what is a urine analysis and blood analysis. For that purpose, we have to know so how can it's going to be segregated by the urine analysis. As a urine important in screening test in the routine test for every patient and not just for the investigation or of the renal diseases. One of the commonest biochemical tests performed outside the laboratory. Actually, in clinical laboratories, urine analysis performed is routinely for assessing the degree of kidney dysfunction in kidney diseases and other diseases that affect the kidney functions also. So routine urine analysis include the analysis of physical and biochemical characteristics of the urine. So now we are going to see about this one as a physical characteristics. So mainly we are going to be concentrate the volume and color. So and then microscopy, and we are going to be mainly focus on the cells. And biochemical level is osmolality, protein, urea, creatinine, glucose, as well as the potential of the hydrogen. So these are things we are mainly going to be concentrate for to checking the urine analysis. And next, so it is a common thing. So we have to know about this. Normally characterized, we have to be segregate the volume level and color, type of color, and appearance and order. Okay, so these are the main thing. So as normally which is present, the volume will be 800 to 2500 ml. Okay, and normally it is looking as a straw color or amber color. This appearance will be clear and normally is mildly aromatic, isn't it? So now we have to know about this abnormal. So if it will be this excess, which means is more than the normal, it will be this excreted the 3 liters per day, which is called as a oliguria. So here the diabetes mellitus, diabetes insipidus, in this condition it will be just going to be excreted more. Oliguria, which decrease is a less than 800, which means a less than 500 milliliter per day. So it is acute renal failure in this condition. Or anuria from below 50 ml so per day, so it's complete the UTI obstruction will be takes places. So next we are coming towards the color. I hope everybody know about this one. Straw or as amber color. So whenever it will be easy to identify in the yellow color, the person have to be affected by the jaundice, isn't it? So in the dark color there is a alkapotoniuria, and red color, so there is hematuria or porphyria. In this condition, this type of the abnormal blood colors will, sorry, abnormal urine color will be appear. So next is appearance. So normally it will be just clear, and but when it will be the person will be affected, the is alkaline urine phosphate or pus will be just mixed with the urine, which means there is any urinary tract infection. So what will happen? There is a turbid when it will be contains. So there is a problem in the urinary tract infection, easy to identify. And next, order, mildly it will be aromatic. This will be because due to the chemical substances there is a aromatic, but so when the person will be affected the diabetic urine, so diabetes mellitus or diabetes insipidus, the acidotic fruity order will be come in the urine. Next we are going to see the reaction of urine. I hope you already know about this. The normal urine potential hydrogens are 4.2, 4.5 to the 8, and is averagely is 6 to 6.5. Okay. Actually, in this time they now is to take the urine samples because they have to be just making the acidic urine or alkaline urine. So after the eating the meal rich in protein, so due to the formation of the phosphate, there is a acidic urine is going to be excreted, and alkaline urine after the normal meal due to the secretion of the acid in the stomach and bicarbonate into the blood. So what will happen after vegetarian meal specifically? So there is the alkaline urine have to be excreted. So the pathological cause type 2 renal tubular acidosis and urinary tract infection by urea splitting organism. So in this condition they are not collecting any samples after the meal. So that's why they have to collect the samples in the empty stomachs. So now we are going to see the next slide. So what is the blood analysis? We've seen the urine analysis. So followed by that we are going to see the blood analysis. So the blood test for assessing the kidney function or serum, urea, creatinine, and uric acid, and electrolytes. So that's why I have just mentioned the less sensitive than clearance test give the rough idea about the functional status of the kidney. It includes the blood urea level, serum creatinine, serum uric acid, serum protein, serum cholesterol, serum electrolytes. Okay, and here now we are going to be checking this normal value. We seen the already about the urine, so for the same for the similarly we are going to see the blood analysis also. So here there is a blood urea, so there is a normal value, that is a 20 to 40 milligram per deciliter. There is a increased or with decrease in the GFR. What will happen is there is comes under the pathological condition. And serum creatinine is, that is a 0.6 to as 1.5 milligram per deciliter. Double the time will be increased when GFR decreased to the 50%. The serum uric acid 2 to 4 milligram per deciliter increase with the decrease in the GFR. And serum protein, and that is how this is given the albumin globulin. So protein molecules, and in nephrotic syndrome albumin globulin ratio will be just reversed. And serum cholesterol is 150 to 200 milligram percentage, and is being increased in nephrotic syndrome. Now we are going to be elaborately we are going to see about the glomerular function test. Under the glomerular function test will be assessed by the renal clearance test measuring the glomerular filtration rate. So what are the tests which is included here is the inulin clearance test, creatinine clearance test, and urea clearance test. And finally there is a serum creatinine estimation, blood urea estimations. So these are tests we are going to just make the confirmation to checking or going to finalize the glomerular functions. Now the renal clearance is the first steps of the glomerular filtration test. Okay, so the clear test mainly determine the glomerular functions, and glomerular function rate provides the most useful index for the assessment of severity of the renal disease. Clearance is defined as a quantity of the blood or plasma cleared of the substances for unit time. This is expressed as the milliliter per minute. It is a milliliter of plasma which contains the amount of that substances excreted by the kidney within a minute. Okay, and actually it is a estimate the amount of plasma that passes through the glomeruli per minute with complete removal of the substances to the account of what substance actually appears in the urine. So here there are me just mentioned there is no singular volume of plasma completely clear of the substances, and clearance is the volume of plasma that would be necessary to supply amount of the substances excreted urine per the unit time. So now we are going to see the mathematically. So here there is a concentrations and as well as a plasma concentrations and volume. So these are things as a mathematically we are going to be see about this one. So I have just clear here there is a clearance of the substances C, and P is a concentrations, or otherwise is a plasma concentrations, and U V is a volume. Okay, so this is a formula. By this formula we are going to be checking the clearance test. The inulin clearance test substance should be freely filtered, neither reabsorbed nor excreted. A substance that is completely filtered but neither reabsorbed nor secreted should be used to measure the glomerular filtration rate. Inulin is the ideal substance used to measure the glomerular filtration rate. It is completely filtered and neither reabsorbed nor secreted. So inulin clearance test indicates the glomerular filtration test. So it's inulin clearance. A known amount of the inulin is injected into the body after some time. The concentration of the inulin in plasma and urine and the volume of urine excreted are estimated. So by this way we are going to be just do the inulin clearance test. So having the same character of this, not an endogenous substances, and administered as intravenously to the patient. So initially is a bolus dose of the inulin is given, then continuous to infusion given to maintain their level in plasma. After attaining the equilibrium with the body fluids, plasma and urine concentration of the urine will be measured. Now with the example of the inulin clearance obtained the from the clearance formula, so the C indicates the concentration of the inulin in urine. I clear. Next equal to, we are going to see about this concentration of concentration of inulin in plasma and volume of when we excrete. So now I hope you easily to understand that one. And this is a, now there is a here 125 concentration of the inulin in urine. For example, is just given the 125 milligram per deciliter or milliliter. So next we are going to be concentration of the plasma as a 1 milligram per milliliter, and is a volume of urine output 1 milliliter per unit. Is inulin clearance equal to, so I hope everybody know what this one is a U into V, which means there is a concentration of the inulin in urine multiply with the concentration of, a volume of urine output divided by concentration of inulin in plasma. So now you will get the answer, isn't it? So it is a 125 multiply 1 divided by 1 is there is a 125 ml per minute. So inulin clearance is equal to glomerular filtration rate. It is helpful for this comparison clearance of the any substance with the clearance of the inulin provides the information about the renal transport process of the substances. For this comparison, clearance ratio will be used in the clearance ratio equal to Cx into the C in, which means the concentration of the inulin. Next, creatinine clearance test. Creatinine clearance is also used to measure the glomerular filtration rate accurately. It is easier than inulin clearance because the creatinine is already present in the body fluids and its plasma concentration will be steady throughout the day. It is completely filtered, and being a metabolite, it is neither reabsorbed or secreted. The normal value of the GFR by this method is approximately the same as determined by the inulin clearance. It is a commonly used method because the creatinine is endogenous substance, no need to give by any intravenous route. Creatinine clearance you have to give by the equation. So actually, what is the disadvantage of this creatinine clearance test is not an accurate method because the creatinine is secreted by the tubules and some may be reabsorbed. Determination of the plasma creatinine is also will be inaccurate. So normal value of the creatinine clearance is 82 and 100 to 110 ml per minute. Next, urea clearance test. The urea clearance test is a clinical test to assess the renal function by using the clearance of urea from plasma by the kidney every minute. This test actually requires for the blood sample to determine the urea level in the blood and 2 urine sample collected at 1 hour interval to determine the urea cleared by the kidney into the urine. Actually, normal value of the urea clearance is a 70 ml per minute. Actually, the urea is a waste products formed during the protein metabolism and excreted in the urine. So, determinations of urea clearance form the specific test to assess the renal function. So now we have to know about this one. So is urea is also an endogenous substances and it not need the giving IV route. So here is a disadvantage of this method. As a partially is reabsorbed by the renal tubule, so it cannot able to give the accurate value. The level will be altered by protein content of the diet and it less sensitivity than the creatinine clearance test. Next, plasma creatinine concentration to assess the glomerular function. Actually, this is a normal plasma creatinine value, so 0.6 already seen in the tablet column itself. And when glomerular filtration rate reduced to the 50%, the kidney will be transiently filter the creatinine and creatinine level will increase in the plasma, which will have to be showing by the graph. So then we are going to be shift towards the next slide. Next slide is the blood urea level. It is also index of glomerular filtration because the urea is a byproduct of the protein metabolisms eliminated by the mainly by kidney. So less reliable than plasma creatinine measurement because the blood urea level is altered by protein diet and dehydration. So normal level, the blood urea level is a 20 to 40 milligram percentage. Actually, the urea clearance test is a clinical test to assess the renal function by using the clearance of urea from the plasma by kidney every minute. Already told about this one, and here actually the test requires a blood sample to determine urea level in the blood and two urine sample collected by 1 hour intervals. So which already I told about this blood urea clearance test, urea levels. Okay, and then we are going to be see the next slides and to assess the tubular functions. So we've seen this. So what are the tests is coming under the glomerular function test. So I hope it will be understand. So that will be fully we are going to be checking up by the blood itself. We are going to be checking the what is the proper function of the glomerular. So now we are going to be to test to assess the tubular functions. So what are the tests is coming under the tubular functions? So first one is a urine concentration test, urine dilution test, test for the acidification, test for the tubular secretory capacity, free water clearance as well as a osmolar clearance. In urine concentration test, actually otherwise is called as a water deprivation test. The patient is advised to eat a normal food at 6 p.m. but fluid intake is restricted to 200 ml. He is further advised not to take anything throughout night. Then next day morning at 7 a.m. the bladder is emptied. The first specimen is discarded at 8 a.m. Urine which is collected at this second specimen is obtained for measuring the specific gravity. So if specific gravity is more than 1.0222 the renal function is normal. If there is specific gravity below this value, the third sample is collected at 9 a.m. and in this sample gives a specific gravity as less than 1.022, then the concentration ability of kidney is considered to be impaired. Okay, so there is a method we are going to be checking by the concentration test with the help of the specific gravity. So determination of the urine volume, actually the measurement of the volume of urine passed in the 24 hours is a simple test of the tubular function. The urine volume is measured separately during the night time and during the daytime. Normally the volume of urine is night is of the volume of urine excreted during the daytime, and increase the excretion of the urine during the night is an early indication of the tubular dysfunction. And followed by this urine concentration, we are going to see the urine dilution test. The patient in the urine dilution test, the patient is not allowed to drink water or fluid after 10 p.m. The bladder is emptied at 7 a.m. in the next day morning, and patient is allowed to take the water load of 1.2 liters in half an hour. So hourly urine samples are collected for 4 hours for determination of the volume, specific gravity and osmolarity of the each samples. Normally the person will be excrete the total water load in the 4 hours, and specific gravity of the at least one sample should fall in the to 1.003 and osmolarity should be in the 50 milliosmoles per kilogram. So there is a actually procedure. So the person has to drink the 1 liter of water, otherwise the 1.2, and urine sample collected every 4 hours. Every hours up to the next 4 hours, and there is a normal 750 ml, 75% of the urine excreted at this time. At least one sample should be as less as 100 and osmolarity and 100 milli osmoles per kilogram, and specific gravity should be as the S and the normal. So this is the things we are going to be seeing. We are seeing this one is the urine dilution test. Next, we are going to see the estimation of the free water clearance test as a quantify the renal urine concentration and dilution. The osmolar clearance, total clearance of solutes from the blood, volume of plasma cleared of the solutes in each minute. And here I just give the equations. There is a COSM, which means the urine osmolarity, and is a plasma osmolarity and urine flow. Actually, these are the concentrations. So these are the calculations which have to be given for the estimation of free water clearance test. It is actually detects the concentration or diluting ability of the kidney. Therefore, it is a better test for tubular function. Actually, the osmolar clearance is defined the volume of plasma water that is cleared of its solutes to excrete the urine with the same specific gravity as that plasma. So that will have to be given here. This is with all of these calculations. Usually this is used to differentiate polyuria of the diabetes insipidus, diabetes mellitus, and excess water drinking. Next, urine acidification test. So usually the acidic loading test is performed to detect the ability of the kidney to acidify the urine. So ammonium chloride is given to the subject as entering the coated tablet, and urine will be collected every hour for 4 to 8 hours for determination of the potential of hydrogen of urine and ammonia excretion of the each sample. At least one sample should have the potential of hydrogen of 5.3 or less, and ammonia excretion should be as 30 to 90 millimoles per hour. And next is for the tubular secretory capacity. Actually, the phenosulfonephthalene is excretion test. So the P otherwise called as a PSP, is a phenol red is called a phenol red test, is used for determination for the secretory capacity of the tubule. The subject is allowed to drink those 600 milliliter of water, following which a PSP is given as intravenously. Okay, then bladder is be emptied after 15 minutes, 30 minutes, 60 minutes, and 120 minutes. And excretion of the phenol red is be noted in each sample. Normally the phenol content is with 35% in the first sample, and followed by that there is a 75 of the dye should be eliminated in the 2 hours. In tubular dysfunction, the dye be excreted in the first sample is less, and also the total amount of excreted in the 2 hours will be less. So by this way we easily to identify there is a tubular secretory capacity, the tubular functions. So this is useful to test to detection the early stage of the kidney diseases. Okay, and next we are going to see the test to assess the renal blood flow. Here is kidney disease 1.2 to 1.3 liter of the blood per minute, 25% of the cardiac output. The renal blood flow can be measured from the renal clearance test, and if the substance will be completely cleared from the plasma, clearance rate of that is equal to the renal plasma flow. So, but the GFR is only about 20% of the total plasma. So, to measure the renal plasma flow, select the substances. Must be excreted tubular secretions as well as a glomerular filtration. And here there's a para amino hepatic acids is a 90% cleared from the plasma. Effective renal plasma we have to be see the concentrations as well as the volume and the content of plasma. The percentage of the para amino hepatic acids cleared from the blood in the extraction ratio is of the para amino hepatic acids. This gives the tubular secretion of the para amino hepatic acids. So extraction ratio is equal to arterial concentration, venous concentration divided by the arterial concentration. So we'll get this extraction ratio as 0.9. From this actual renal plasma flow, and it will be extraction ratio is the renal plasma divided by the extraction ratio, and here around we'll get this 630 divided by the 0.9 is equal to 700 milliliter per minute. From this renal blood flow we easily to identify here yeah, there is a arterial ratio of the renal blood flow plasma flow into 1 by 1 divided by the 1 minus hematocrit equal to 700 into 1 divided by 1 minus 0.55 equal to 1273 ml per minute. So by this way we are easy to identify the tubular function. So with the help of this type of the test we are going to be checking the glomerular function test. With the help of this blood we are going to be checking the glomerular functions, and by the urine we are going to be checking the tubular functions. So with the help of this calculation we are going to be easy to identify whether we properly function of the tubular or not, and by the blood we are going to be checking this whether properly glomerular functioned or not. So by this way we are going to be checking this the renal function test. So next we are going to see about this is the research techniques. So we already told about this, there is a radiology, renal imaging, biopsy, renal biopsy. So these are the test techniques how to be easy to checking the glomerular function as well as the tubular functions and all. Okay. And diagnostic procedure I have to just given about the plain X-ray film of the abdomen. So role in detecting the small renal calculi and ureteric calculi with the minimal or no proximal dilations, and give the idea about the size, shape and position of the kidney. Okay, and followed by that we are going to see this intravenous pyelography. So diatrast or iofax is given by the with the normally excreted rapidly by the kidney. Normal person pyelogram obtained in 2 to 10 minutes. Any stone or growth it will be take more time, and also it will be helpful to study the size and shape of the kidney. Okay, next we are going to be about this ultrasonography. So it provides an excellent information about the anatomy of the urinary tract. The procedure is ideally suited for children since it is a painless, requires no sedations, and carried out even the bedside. Okay, and then followed by that we are going to see the CT scan, is computer tomography scan. So providing the anatomical information gives the functional status of the kidney if an IV contrasting agent will be used. Examining the mass lesions of the kidney, bladder or retroperitoneum, so that secondly affect the urinary system. So these masses of the maybe is congenital or tetroma, inflammatory, traumatic and neoplasmatic. So and followed by that renal biopsy, and is expert evaluations of renal histology is important in the diagnosis of various renal parenchymal diseases involving the glomeruli, tubular interstitium and small blood vessels. So next this procedure has become much simpler with the use of the automatic. And followed by that the child lies in the prone position with the, and yeah, I have to change it. A folded towel or a bed sheet placed under this lower rib. The entry of biopsy needed into the kidney when it pierces the renal capsule in it is indicated by the slight resistance, and once in kidney it moves with the respiratory movement. What are the uses for this one? To give the knowledge and better understanding of the glomerular as well as the tubular diseases, and to easily to diagnose the patients with the proteinuria or of unknown causes, and to diagnose the patients with the unexplained renal failure. So experimental studies is the micro puncturing, stop loop techniques and microscopic studies. And finally we have to know about this one. So the renal function test, how do we detect the renal damages to monitor the functional damage, help to determine the etiology. And next we are going to see about the diuretics. And what is a diuresis? So diuretics or diuretic agents or substances which enhances the urine formation and output. This substance will be increases the excretion of water, sodium and chloride through the urine. Diuretic agents is increase the urine formation by influencing any of the process involved in urine formation. Diuretics are commonly called as a water pills. So diuresis is the increase in volume of urine output. So what are the diuretics? Diuretics are the substance that causes the diuresis. And what is the natriuresis? To increase the sodium output in the urine is called the natriuresis. So next we are going to be see this use of the diuretic drugs to reduce the extracellular fluid volume and hypertension, congestive heart failure, liver cirrhosis and premenstrual edema, edema of pregnancy and renal disease. Okay, and these are the things be under the diuretic drugs. So next we have to know about this one. So what are the types of the diuretics? Okay, so osmotic diuretics, diuretics, and thiazide, and competitive inhibitor of the aldosterone, carbonic anhydrase inhibitor, sodium channel blockers, and these are the types of diuretics. Now you are going to see the one by one. So what is the osmotic diuretics first? And yeah, so here is osmotic diuretics or the substances that induce the osmotic diuresis. Osmotic diuresis is the type of diuresis that occurs because of the increased osmotic pressure. Some of the osmotically active substances are not reabsorbed from the renal tubules. When injected in large quantity into the body, so what will happen? This substance will be increase the osmotic pressure in the tubular fluid. So increase the osmotic pressures in the tubular fluid in turn reduces the water reabsorption. So it leads the excretion of the excess amount of water through the urine. So it will just elevated the blood sugar level in diabetes can also this causes the osmotic diuresis in the same manner. So what examples is the urea, mannitol and sucrose and glucose. These are things going to be easy to excrete. And followed by that we are going to be see the what is the loop diuretics. So loop diuretics of this types inhibits the active reabsorption of the electrolytes as the sodium and potassium from the renal tubular fluids. So loop diuretics also are the substances that inhibit the electrolyte reabsorption in the loop of Henle. So these diuretics inhibits the sodium and chloride reabsorption from the thick ascending limb of loop of Henle. So the osmotic pressure in tubular fluid will be increases. So what will happen? It will lead to the diuresis. The osmolarity of the medullary interstitial fluid also decreases due to the inhibition of sodium reabsorption into the medullary interstitium. So then now what happened? The medullary interstitium fails to concentrate the urine, resulting in loss of excess fluid through the urine. So here, so what are the things is going to be just excreted now? So furosemide, torsemide and bitumen. So these are the things. Next is followed by that we are going to be see this thiazide. Thiazide diuretics are the type of diuretic. They act directly on the kidney and promote the diuresis by inhibiting the sodium chloride co-transport located in the disconnected tubule of nephron. Thiazides decrease the sodium reabsorption, which increases the fluid loss in urine, which in turn decreases the extracellular fluid and plasma volumes. This reduces actually this reduces cardiac output and is a lower blood pressures. Thiazides also work in other ways, low blood pressure. Thiazides also cause a potassium loss while retaining the calcium. So diuretics are usually used for the blood pressure lowering the effects of, because the diuretics actively relatively weak compared to some other type of the diuretics, like such as a loop diuretics. Okay, and followed by the, finally we are going to see the and carbonic anhydrase inhibitors. The carbonic anhydrase inhibitors, uh, the activity of the carbonic anhydrase in the proximal converter tubules and prevent the reabsorption of the bicarbonates from the renal tubules, resulting in osmotic diuresis. Such as the diuretic agents are called as a carbonic anhydrase inhibitors. Acetamide and uh, acetazolamide is a carbonic anhydrase inhibitors. Okay, so I hope you will be easily understand so what is the renal function test and what are the clearance and what is the diuretics. I have to tell about the overview of the renal function test, renal clearance and the diuretics. The renal function test is very simple. Actually in renal function we are going to be checking the renal systems. So for that purpose we are going to be easily to segregate it two part. One is the glomerular area and another is the tubular area. So glomerular area we are going to be checking by the with help of this blood, and the tubular part we are going to be checking with help of the urine, isn't it? So now we are going to be see the clearance also. So what are the substances which is be present in the blood and the urine. So with help of that one we are going to be know about the function of so glomerular and function of the tubular. So we will see the both the function will be as a normal. So there is a renal system will be as a normal. So followed by that we are going to see the diuresis. So what is the excretion? So how we are going to be excreted the water. Okay, so I hope you will be understand the class. So if you have any doubts, have any clearance, have any clarifications, so please comment below. You have to be free to ask and free to text to me. Okay, okay students, thank you.